So before we get to talking about what is actually involved in IVF, we always like to talk about the patient journey and actually point out some of the common misconceptions. The first one being that IVF is a solution to all fertility problems, that it works first time, and that it will guarantee a baby. And sadly, we know that more often than not, an IVF cycle won't work and actually will need multiple cycles to achieve a pregnancy. And for some people, it may never work. So it's really important to understand if you're supporting someone going through IVF, this isn't something that you necessarily feel when you're going through it is a really exciting procedure. It can be quite scary, and the uncertainty of going through a process and not knowing whether or not it's going to work can be really difficult to deal with. There's also the misconception that IVF treatment is just a few injections, it's just a few scans. And as I will show you when I take you through what a typical IVF cycle looks like, it is so much more than that. There's also the misconception that fertility treatment is a lifestyle choice, a simple choice, an elective procedure that people choose to go through. Now, we would definitely say that this isn't the case, and for many people, it is their circumstance rather than choice that brings them to needing fertility treatment. So, from my own perspective, I was diagnosed with premature ovarian insufficiency, which effectively meant that I was entering early menopause when I was in my late 20s. So, for me, the only option to give me that chance of having a baby was to go through IVF. There's also the misconception that the issue is always with the woman. We know that there is a pretty much equal split between male factor and female factor infertility, and men are often left out of this conversation. It's really important that we include men as well. We also know that sadly, a positive pregnancy test isn't the end of the journey. One in four pregnancies sadly end in loss. We know that that can be even greater number, particularly because we don't necessarily record all of the pregnancy losses in those early stages. And we also know that for those who are going through IVF, you're often very aware at a much earlier stage than you might ordinarily be that you are pregnant. And so you can be very aware of what could be an early loss or is what is termed as a chemical pregnancy.